Hi, my name is Diana Ivy-Daniel, and today I'll be showing you how to take proper vital signs and how to do a proper chest assessment. So before we go into the patient's room, you just want to go over their chart and see if there's any clinical significance or to see if there's any trends that are happening, to see if when you do take vitals, if there's any changes or anything. So before you go into the patient's room, you just want to get your equipment ready. You want to get a blood pressure cuff, your stethoscope, your pulse oximeter, and then you just want to make sure that you have some hand sanitizer. So you can just go into the patient's room. Hello. Hi. So you just want to take 3 mLs of hand sanitizer as you're going to the patient's room and rub it in your hands for 15 seconds or until it's fully dissolved. Hi, my name is Diana Cedeno and I'm a respiratory care student at Hartnell College. Can I get your name and date of birth, please?
Sure, it's Minky Islas, 9/27/82.
Thank you. Can I see your wristband, please?
Sure.
Thank you. So today I'm just going to do take some vital signs and then do a chest assessment, okay?
Okay.
Okay, so I'm just going to go ahead and start with her blood pressure. So while taking their blood pressure, you want to go ahead and check for their brachial pulse. And the normal ranges for blood pressure would be 120/80. If it's over 140/90, that means that it's indication for hypertension, and if it's anything below 90/60, that's for hypotension. Can you go ahead and just hold this for me,
Sure.
please? Thank you. So you want to go ahead and just check for their brachial pulse. And then you want to make sure that you're putting on the cuff a little snug. It's okay?
Yes.
Let me just undress. There you go. Alright, and then you just want to stick your stethoscope where the radial pulse is. And then the first time you do it, you just want to go ahead and pump it until you don't hear the pulse sound anymore, and then when you're going to take the actual blood pressure, you want to go 30 past where you didn't hear the sound. You just want to release it, and then you want to go and start again. Are you okay?
Mm-hmm.
Is it okay and tight on your arm?
Yes, it's good. Thank you.
Alright, so your blood pressure is 115/75. Is that normal for you?
Yes.
Okay,
Thank you.
You always want to make sure that you ask if the blood pressure is normal for them, because they could have a lower blood pressure that is just depending on the person. So after that, I'm just going to take her heart rate and her respiratory rate, and while I'm doing that, I'm going to go ahead and put the pulse oximetry on her finger while I'm taking those vitals as well. So can I just put this on your index finger? And then when you put the pulse oximetry, you just want to make sure her hands aren't too cold. They're like room temperature, so it can get an accurate reading. You want to make sure that they don't have any nail polish to get accurate reading. If they do, you would just want to get a different pulse oximeter. So go ahead and put it across your chest. Thank you. And then while taking the heart rate, you want to use your index and your middle finger. You don't want to use your thumb because you do have a pulse in your own thumb. So if you use that, you could be reading your own instead of the patient's. And then while taking the respiratory rate, you don't want to let the patient know that because it could alter their breathing and you could get an inaccurate reading. And you want to take the pulse rate or the heart rate for 1 full minute and the respiratory rate for 1 full minute. Okay, so go ahead and relax. And then when taking it, you just want to make sure that her heart rate correlates with what's on the pulse oximetry. So your heart rate was 72 beats per minute, which is normal. The normal ranges are between 60 and 100, so that's good. Your respiratory rate was 14, and the range is 12 to 20, so you're good for that.
Okay.
And then your pulse oximetry was 98, which is good. You just have to be in between 95 and 100. Okay. And then for if their saturation for their oxygen is below 95, that just indicates that they do need some oxygen, so you just want to put them on oxygen therapy. Alright, so that is all the vitals. I'm going to go ahead and start with the chest assessment. So the first thing that I want to do is I want to palpitate her in the apices to see if there's any subcutaneous emphysema. So is it okay if I just touch up here? Alright, so she's showing no signs. There's no air that's trapped up there, so she's good. For her thoracic configuration, she has good thoracic configuration. There's no abnormalities or anything like that. And so if you can turn around, I'm just going to do your thoracic expansion. Thank you. So for that, you just want to go ahead and in their lower back, just have your thumbs against her midline, and then you just want to have your patient do a deep inhale and see if if there's any expansion. Okay. So go ahead and do a deep inhale for me, please. Cool. Thank you. So my thumbs did go away from each other a little bit. You want to make sure that it goes between 3 to 5 centimeters. So I'm gonna go ahead and just check for lung signs. Okay.
Okay.
So when you auscultate and you check for lung sounds, you just want to do a ladder effect, starting from the left bottom, and then you're going to go to the right bottom, then you go to the right middle, then the upper right, and then the left upper one, and then you're going to check both of her sides, and then do the same ladder effect in the front, and then you're just going to check her throat. So every time you feel my stethoscope, I just want you to take a deep breath in. Okay.
Okay.
So you just want to warm your stethoscope so it's not too cold. So go ahead, deep breath. Thank you. Thank you. Okay, if you can just go to the front for me, please. And then is it okay if I just check your sides and then check your front?
Yes.
Okay. Deep breath. Okay, I'm just going to go around to the other side.
Okay.
Deep breath. Cool. And then is it okay if I just,
No,
if I just unbutton the
Yes.
top? Alright. And just deep breath. Thank you. And then just one more at your throat. Perfect. And if you are on a female patient, if they do have bigger breasts, you just want to make sure that you ask them to lift up their breast so you can check underneath at the base of the lungs. Cool. Perfect. Are you feeling okay?
Yes.
Okay. And then you also just want to check for any breath sounds. See if there's any wheezing, which could indicate bronchospasms, and you would want to put them on a bronchodilator. If there's any crackles, which could indicate pneumonia, and then if there's any rhonchi or coarse crackles, that could indicate the patient has COPD. So after that, you're all done with your vital signs and your chest assessment. So if you feel anything, just there's a call button, just let me know, okay?
Okay.
Thank you. Have a good day.
You too.
So after you exit the patient's room, you just want to take 3 mLs of hand sanitizer again and rub it in for 15 seconds or until it fully dissolves. And then you would just want to chart all the vital signs that you took and write down your chest assessment to make sure that you can monitor for any signs. And then if she needs to be on any medication, you can see what the adverse effects, if there's any, to make sure she's okay. Thank you for watching.